Thank you for joining us this Friday afternoon. I'm Charity Menifee, the Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. For a moment of gratitude today, we again want to thank our faith community. We know that this is a very, very special weekend for our families of faith in Knox County, and it's hard to not be gathered in person. Our faith communities are continuing to do a great job utilizing creative methods to keep us spiritually and relationally close without us being physically together. And for that, we are grateful. Moving into our local situation, we have 154 confirmed cases of COVID-19 in Knox County. 115 of those cases have recovered. In yesterday's case count, we reported that 19 individuals had been hospitalized at some point in their illness. Today, we're reporting 18 cases, and that is because one person, through our investigation, we realized resides in a different jurisdiction, and their case count number is being transferred to that jurisdiction. I'm also pleased to report that we have had no additional deaths of COVID-19 complications in Knox County. The death that we did mention yesterday is a resident of another state and will be counted in that state's jurisdiction. But we do extend our deepest sympathies to the family of that individual. We are continuing to update our website daily. That said, we have more information that we will make available this afternoon, including information on race and ethnicity and a heat map on zip codes, or case counts by zip code will be available today. In regards to the medical surge and alternate care site task force, we're getting a lot of questions on that. And this is a very, very fluid situation. As of today, our understanding is that Nashville and Memphis are being prioritized by the state for alternate care sites due to their large case counts, and planning is on hold from the state perspective for our local planning response for our location. TEMA and the Army Corps of Engineers will ultimately just make the final decision of a site selection here in Knox County if we have one. But our local task force is responsible for planning and operations of that location. Our task force feels it's very important to look at many different models or COVID-19 predictive models regarding cases and potential surges, and they're doing that very closely, regularly, and they're continuing to assess regional data so that we can get the best picture of our local situation. Our local task force first priority is to maximize the surge capacity at our regional hospitals before we have to go to an alternate care site. However, our task force feels that it's prudent to continue planning for a worst case scenario and is sharing that sentiment with the state. Yesterday, we also mentioned that we will be increasing our testing capacity at the health department beginning next week. Previously, due to supply constraints, we had the supplies to test about 15 to 20 people per day. Beginning Monday, due to an increase in supplies, we will be able to test more than 90 people per day at the health department. Because of this increase in resources, we are also able to explain clinical criteria for the testing that we will be doing. Testing remains one of the most important ways to determine the state of health in Knox County, and we are encouraged by this progress. We will continue to test Monday through Friday at the health department, just as we have been doing. People will need to call our information line prior to testing to receive an appointment. That number is 865-215-5555. If you have a primary care provider, as we've been saying, we still encourage you to reach out to them first to get a full clinical assessment. And as a reminder, we do keep a list of walk-in and urgent care clinics who are testing through our phone bank, so people with questions can give them a call as well to get that information. Speaking of our phone bank, it will be closed this Sunday to allow that team to be with their families over the Easter holiday. However, our COVID-19 response, including contact tracing, case investigations, and notifications, will continue 7 days a week. And with that, I'll open it up for questions.
The first question we have is from WATE. They say, with 35 active cases now in Knox County, can you say where we sit in terms of the curve?
I think that we're seeing a slowed rate of increase in our cases, which is exactly what we want to see. And we're encouraged by that with the social distancing that we have going on. But we are still seeing a steady increase in cases. So we have not come back down the other side of a curve yet. We're still going up on the front end of that.
As a follow-up to that question, they ask, could you say whether the worst is behind us?
Well, I think just because of what I just said, we can't say that at this point. We can't say the worst is behind us while we're continuing to see increasing cases every day. We look forward to getting to that point, but right now we're still seeing a steady incline or a steady increase in cases every day.
Also from WATE, what benchmarks do public health officials look at when deciding whether to reopen certain segments of the economy?
I think that's really a very in-depth discussion that is being had at all levels right now, looking at local, state, and federal data, and we will continue to look at our local and regional data and make recommendations based on what we're seeing here at this time.
This next question from WBIR, the governor's stay-at-home order is set to expire in just days. Do you think we'll be ready to lift restrictions then? Would the health department put a Knox specific order in place if the governor lifted his order statewide?
I think we still have a few more days on that. So we are in discussions right now on what that needs to look like at our local level. And we will see what the governor says as he gets into closer to the expiration of that order.
From the Compass, what will the new testing criteria be?
There's a lot of detailed information right now, but I can say that it's looking more at the other comorbidities, the illnesses that you may have that may increase you for being at risk for COVID-19 complications. So we're looking at more of those things, looking at some more symptoms that people may have that aren't in the traditional big three symptoms that you hear at fever, cough, shortness of breath. So trying to expand that criteria to offer testing to even more people is very important to us. And the details will be available soon on that.
Cole, I believe Charity just touched on your question there, but if you had anything additional for that first question, feel free to let us know. WBR has also asked who can get a test right now in Knox County and why is testing so important? They reference that Knox County is ranked number 22 in terms of tests completed on a per capita basis in Tennessee. And do you wish that was higher?
Well, of course, we really have been talking a lot about wanting to increase our testing capacity, and I think we are getting there more and more. And testing is important because that allows us to identify cases and then be able to talk to their contacts, as we've talked a lot about with contact tracing, to make sure that they stay in quarantine or isolation to keep them away from other people. So it really helps to have a good picture of where we stand and be able to communicate directly with people that are most risk of spreading this illness.
They also asked who can get a test right now.
Who can get a test right now? Well, there's a lot of different ways. So again, lots of doctors' offices are testing, walk-in clinics are testing. They have their own criteria. We highly encourage you to call them. And for us, the testing criteria has really, because of our supply issues, we've had to have it focused more on following the state guidelines that they previously had in place to have either be a close contact of a case or have fever, cough, shortness of breath, those types of things. So we're trying to expand that now that we have more resources available to do so.
From WBIR, do you communicate with your counterparts in other area counties, and are you seeing the same kinds of encouraging numbers?
We talk and communicate regularly with everybody in our region, our counterparts at the Eastern Regional Health Office, and we talk with the state regularly. I think that across the board, you're seeing that social distancing has been doing a good job of slowing the rate of increase of illness in our areas, and that's an important thing. But we talk regularly.
From the News Sentinel, are area hospitals and physicians' offices expected to increase testing capacity as well?
I can't speak to exactly what their capacity is, but we know we are hearing and seeing more and more physicians' offices testing. The hospitals have been testing, but we're seeing more outpatient providers and walk-in clinics and those folks coming online, and we're encouraged by that.
From WBIR, can you explain what recovered means? We know it refers to people now out of isolation, but those aren't all people who have been hospitalized, correct?
Yes, that is correct. So this is people who are out of isolation, which means that they have been 7 days from their onset of symptoms plus 72 hours of feeling better, fever-free, and they're generally feeling better. So that's the criteria that we use for that. Does not mean you had to be hospitalized.
If there are any other questions, can you please go ahead and submit them in the chat box, please? All right, one more from WBAR. They say, we've heard that people with antibodies may carry virus immunity. Can you speak to this? Is it possible that asymptomatic people have some immunity to COVID?
there is a lot of new information coming out every day on this, and that is, I think, still up. I think one of the things we want to talk about with science and data in general is that we want to see an abundance of information on these things and not one single study. It's generally how we work. We want to see where data and information start to converge so we have more confidence in what we're seeing. And so I think that that's an important point to make, but I think that's encouraging information, and we'll continue to look into it as more information is released.
From WATE, what are some of the takeaways you all have made from the data you are releasing on your website later today relating to race and zip codes?
Oh, that's a really good question. I think that, again, I spoke about this earlier with race information. I think it pretty well coincides with what our racial demographic is here in the area, but I also don't think it's a surprise when you read stories and hear about racial disparities with African-American populations having more complications with COVID. And again, I think that speaks to the bigger picture of other disparities that exist with the population, higher rates of heart disease and diabetes and that kind of thing that we really want to highlight and tackle as well from a public health perspective.
All right, any other questions? Please go ahead and submit them now. We'll give it just a couple more seconds. Okay, well, thank you all. We appreciate you joining us, and we hope you have a good holiday weekend.